Christy. How are you doing today?
Good, how are you?
I'm doing good. So how's your meetings going that you've been going to?
They're going alright.
They're going good?
Yeah.
You getting a lot of input from them and support?
Yeah.
Did you find your sponsor yet?
No, not yet.
Okay, well make sure you work on them.
I will. I'm still searching.
Okay, and you're working already, I hear, so you're doing good there.
Yeah.
How's that going?
It's going good. I like it. Could be better, but a job's a job.
Having any problems with it?
No, not yet.
Okay, and what about your counseling sessions?
They're going as good as a counseling session could go, I guess.
Okay, and what about your meetings with your kids? How's that going?
They're going good, a lot better than I thought they would. I'm just glad I get to see them every chance I get.
That's awesome.
Yeah.
Yeah, I can tell you're excited. You look like you've had a really good week. And from what I've heard, it's been pretty good for you.
Yeah, it has. It's been a very good week.
So you've been in the program now for about 3 months. So how's that feeling?
Different. Not the life I'm used to, so I'm starting to get used to it, the hang of it. It's hard to change that short amount of time. But it'll be well worth it.
Okay, and what about school? You had said you wanted to go back to school.
I haven't started yet, but I'm looking into my options.
You're looking into what are you leaning for to go for? In what area?
I kind of really want to be like social worker, I think.
Oh, that's awesome.
Taking all my experiences from life will really help me.
You could give a lot
through
back.
that. Yeah.
So that's good. So any problems here at the house?
There's a couple of girls I don't really get along with, but I just try to keep to myself.
Okay, have you tried to ask them about the issue, talk to them?
I've talked to another counselor about it, but it's better just to keep to myself about it than start more problems.
Well, you know, one thing that is very important is to learn how to confront people in a respectful manner. That's really important, to learn how to stand up for yourself.
Yeah, that's true, I guess.
So maybe you could take them aside and say, hey, can I talk to you for a minute? Why are you doing this? If you have an issue with me, you think we could talk about it and work it out? Have you thought about doing something like that maybe?
Thought about it, I'm just not good with my words. I get mad really easily, really quick. And just kind of make the situation worse than what it is.
Are you learning anything to help you deal with that?
Me and my counselor have talked a little bit about my anger problems, but they're hard to control. I'm getting a little bit better at it, but
Okay, have you taken advantage of our parenting classes? How far along are you with them?
I've gone to about four different parenting classes, and just as much as I have to go to them, it's really benefiting me a lot to go to them. I mean, there's a lot of stuff that I've learned that I didn't know, that nobody ever told me when I had kids.
Like, what have you learned?
I've learned, I don't know, it's a lot. I just learned basic things that you need to know with being a mom, like a lot about their safety and things like that. I took a CPR class through the organization where I take my parenting classes, which made me really think a lot. A firefighter came in and talked to us and explained the different safety risks around the house for the kids and things like that. So I've learned a lot from them.
Okay. And when is your next counseling appointment?
Tuesday.
And what about your next parenting class? They meet once a month, correct?
Yes, I think it's on the 3rd, I believe.
Okay.
I'll just check my calendar on that one for sure.
And how is your family therapy sessions going? You know, the ones we have here at the house.
They're going okay. No, it's still hard, especially for me, trying to work through the issues by myself, and then trying to work through issues with my family on top of that.
How'd it go with your mom?
As good as it could have gone, I guess.
What would you have liked to have seen happen differently?
I mean, I know she supports me with what I do. I wish I felt like she supported me a little bit more than what she is.
Okay, and I got a report that you have now found out you are pregnant.
Yeah, about 2 months.
And how are you feeling about that?
It's discouraging, but it just gives me one more reason to end my habits and get on the right track. So I'm just hoping and praying every day that I can get my life together.
So you have a 2-year-old and a 1-year-old, right, Jason and I?
Yeah.
And now you're going to have a third one?
Yeah.
So,
Scary.
I
Very
bet
scary.
it is. So, do you have support and help with them?
My mom right now has both of my kids. She helps a lot. She's pretty good about helping, but besides her and my dad, I don't really have any kind of support.
Okay, are you planning on keeping this baby?
I'm not sure yet. I think it just depends on how well I do with my program and where I'm at with my kids now, with the caseworker and things like that. I guess I'm just kind of going day by day, trying to see where I am and how it goes.
Okay. Have you thought about the long-term effects of adoption?
Yeah.
So it's kind of a lot to take in.
Yeah. So a lot more stress on top of all the other stresses I have.
Okay, and you've been to your doctor already and been seen for the baby and...
I haven't been to the doctor yet, but I've set up an appointment. I'm just waiting for insurance and things like that to get stated because I just got a job and can't really pay to go to the doctor yet, so...
Okay, well, we can probably get you an appointment at the neighborhood health clinic. So we need to work on that. So we need to get that set up right away for you, okay?
Mm-hmm.
Because no matter what you decide to do, we need to make sure that you and the baby are taken care of. So we will get that. We'll do that at the end of the meeting. We'll make a call and get you an appointment set up there so you can get in there.
Okay.
You have applied for your Medicaid already, correct?
Yes.
And we're just waiting on its pending?
Yeah.
Okay. Well, it looks like you're doing really good. You're right on track. I'm really proud of the progress you've made. It's just awesome.
Thanks. I'm really trying. Got
You're
a lot to look forward to in the future.
You're doing really good. You're doing really good, Chrissy. Okay, so we will set up another appointment for next week. How about Friday at 10?
That's fine.
Okay, and we're going to make that phone call here in a minute and get that appointment set up so we can make sure of how you're doing with your pregnancy and all that. But it's like you're doing really good. Continue with your 7 meetings, 1 a day. And your counseling, make sure you keep up with that counseling because that will help you also with the adoption decision, whether you decide you want to go that way or you want to keep the baby. And the next time we meet, we're going to discuss a little bit more about some programs there are that can help you with housing and stuff once you've completed your program here. But so far, it looks like you're right on track.
Thanks. I'm really trying.
Hopefully
I'll make it through it successfully and stay down the right road.
Well, you're doing really good. You've been clean for 3 months. So that says a lot right there. You got a job. You're lining up going to school. You're doing really, really well. So I want you to make sure that you realize that, how well you're doing, because that's important for you to be able to acknowledge that. Okay, and we will see you next week then.
Sounds good.
And make sure if you have any problems or concerns or anything, you know where my door is. Just knock on my door because I'm always here.
Okay.
Okay.
Thanks, Janice.
Thanks a lot, Kristen.